Hello, everyone. Welcome. Just going to give a minute to let everyone in. All right. Well, welcome, everyone. My name is Jessica Collins. I'm with the Public Health Institute of Western Mass and really excited today to be kicking off at least our webinar series at the Public Health Institute of Western Mass and want to give the City of Springfield Health and Human Services Commissioner Helen Colton Harris a shout out for her. I believe it's the 30th year of celebrating April as Public Health Month. And the theme this year is We Are All Public Health. So welcome to everyone for this overview of 413Cares.org. We have some really wonderful speakers today. And just to quickly go over the housekeeping, if you have technical difficulties or need help, please send a direct chat to one of the hosts. We are recording this webinar, and the recording will be emailed to registrants and posted on our Public Health Institute of Western Mass website. There will be a brief question and answer at the end after our four panelists, and you can also submit questions using the Q&A feature found on our Zoom or your Zoom menu bar. If you would like to enable automatically generated captions, click the closed captioning button on your Zoom webinar. And please note that because this is an automated feature, they're not always the most accurate, but they're close. And when the webinar ends, we will ask that you please complete a short survey about your webinar experience. It will only take 1 to 2 minutes, and we will share that link at the end. So I want to hand it over to my colleague, LaVonna Homstead, and she will start us off on this important webinar. Thanks, LaVonna.
Thanks so much, Jessica. I'm excited to jump right into the webinar about how to use 413Cares and how organizations are really using it as a way to strengthen the local safety net in Western Mass across all 4 counties of our region. So we got through Jessica was very quick and got through the welcome and housekeeping, so that's great. We're gonna share a little bit of how 413Cares got started, do an overview and demonstration for those of you who haven't really explored the site yet. We'll show you around a little bit. And we have a wonderful group of organizations here to share their experience using the site and how they've been doing that, and then open it up for questions, as Jessica said. So before we get started, I want to get a sense of who's with us today and how you use 413Cares is really the first poll. So how do you use it? Kelly, if you could go ahead and launch that poll, that would be great. We'll leave it open for a few minutes or for a few seconds for people to complete. And this will just help give us a snapshot of how much people are already using it. And if you're not, that is totally fine too. This is a great space to learn what it's all about. Give it a few more seconds. All right. So Kelly, thank you for putting up the results. So a majority of people that are joining us are using it to do searches. That's wonderful. And wow, almost half of the folks are using it for referrals. That's wonderful. Updating program information, we have about 10% doing that. And then great, some of you have not used it before, and I hope that you'll learn something today. So we can go ahead and close, and we have one more poll of just knowing where people are tuning in from and where you primarily work. So Kelly, thank you. So take a few seconds to click on that poll. All right, just a couple more seconds for that. All right, I think we can close that. We have one person from Berkshire County. Great, thank you. A lot from Hampden County. That's welcome, everybody. Franklin and Hampshire are there too, and then someone from outside. So wonderful. Thank you all for sharing. So I just want to talk really briefly about how 413Cares got started. And it really, so 413Cares launched in March 2020. It was, I think, the public launching date. And it really got started because there was a need for people to connect to services in the community and for organizations like community-based organizations and other social service organizations, as well as healthcare, to really be able to refer to each other and connect people they might be supporting to other types of services out there. And this really goes to addressing the social determinants of health and having a tool, this online community resource database that is 413Cares, to connect people to different services that address their needs in these other areas that really have a significant impact on their life outcomes and their well-being. So different educational services, healthcare services, services that can support their neighborhood and their environment, different community and social services, as well as financial services. So 413Cares has a wealth of programs on the site. A lot of them are really addressing these social determinants of health. And when we look at what people are really going to 413Cares for since it started, we overwhelmingly see housing as the top category that people are searching for. So on average, we have 35% of searches every single month are related to housing. This could be help to find housing. This could be help paying for utilities. This could be other things related to their housing needs. And we also consistently see food as number two. It's around 17 to 18% typically every month of people searching for food-related resources. And I'm thrilled that two of the organizations here can speak to the housing services and the food services that they provide. And then we pretty consistently see health as our third most searched for category. But when we look closely at that, a lot of the searches that are being done in that category are really around mental health and substance use. So that might not be surprising to many of you, knowing that those are incredible challenges in our communities. And so people definitely are in need of those types of services as well. But you'll see people are also searching for a variety of other things, everything from childcare to home goods, transportation, financial and education services, legal, employment. And then I just wanted to give a snapshot of regionally how what the top three categories are. And you see there's no fluctuation of the top three being housing, food, and health. But in Berkshire County, the difference is a lot different than if you look at Franklin, Hampden, and Hampshire counties and what people are searching for. So it's a little more evenly distributed in Berkshire County, which is interesting. But in Hampden and Hampshire and Franklin County, we'd see housing really jump up there to that number one spot. So I just wanted to provide a little bit of that context for you all. And I'm going to now pass it over to my colleague, Francheska Bermudez, to really walk you through more about what 413Cares is and demonstrate how to use it.
Hi, everyone. Thanks, Lavana. So my name is Francheska Bermudez. I'm the program coordinator for 413Cares. And so I'll just go over what it is and show you the site. So I know most people are familiar with doing searches, so hopefully this can be a refresher. But for those that maybe didn't make it to this webinar, we can share the recording so folks can get to know what we do and how they can benefit. So to provide an overview of 413Cares, it is a free community resource hub database where folks can search for what they need based on their zip code. So you input your zip code and see what's near you to help you out. So it is free for everyone, for an individual needing the service, but also for organizations to share their services and programs on here. And so the website can be translated into various languages so that it's accessible for everyone. And really the tech platform behind 413Cares is Find Help. They are a national platform that has a network of free and reduced cost services all over the nation. We are just a Western Mass branded version of Find Help. And so we get a variety of support from our advisory board that we have. We're funded by Bay State and the Massachusetts Department of Public Health, and we are managed by Public Health Institute of Western Mass. And so over the years, we have partnered with various organizations, whether it's simple 413Cares promotion, embedding 413Cares to staff workflow, or creating resource pages, etc. We have and will continue to build connections to make sure we're all working to benefit the community. So here we have our long list of organizations that we are involved with or have communicated with and are supporting us. And then as part of that, we have developed 5 regional partnerships this year to help us increase awareness of 413Cares and increase the use of it. So these partners include Berkshire Regional Planning Commission, Pioneer Valley Planning Commission, Hilltown Community Health Center, Quabog Hills Community Coalition, and then Community Action of Pioneer Valley. They are specifically helping us bring 413Cares to various places and audiences in all 4 counties and the areas and municipalities up there as well. So again, this platform is for everyone. So whether you yourself are looking for the service that you may need, or you're helping someone to find these services. So for both individuals and organizations. And so essentially you just search for your zip code and look at what's near you that can help you out. And then organizations can use this platform to manage their programs and their services, set up referrals, and track analytics based on their program. Some more data to continue off data Lavana presented, but we have a lot of users and searches done on 413Cares this year. Early this year, we hit our milestone of over 100,000 searches done on 413Cares. So that is great. And we have over 3,000 programs, and a third of them are claimed, which I will get into in a second of what that means. And as part of our way of gauging, how our platform reaches the community, Square One, which is one of our partners, and they take referrals on our platform, shared in this video how they use the program to create services and programs for their families and help them out. So Lavana can play the video. Lavana, it's not sharing sound.
Here at Square One, we work to just strengthen parenting and family well-being. For a parent who wants to accept a job, you need childcare when you need it. To me, there would be nothing better than have all of my slots filled. There are more families that need our help that we need to reach a hand out to. 413Cares, connecting people to what they need in the moment, has just just been critically important.
You can take advantage of the search bar and search exactly for what you may need for your child, whether that's early childhood education, daycare. There's always this big teal button on the right side of a program card. If that's a program that you're interested in, go ahead and click the teal button to connect with them.
If you can type 413cares.org, you can find what you're looking for.
All right, so we have other videos like that on our website, so feel free to check them out. And so as a leeway to that, I'll share the platform of how you can do searches and what information you can get from it. Like I said, I know a lot of you are familiar and use 413Cares to do searches. So maybe I can feature some of our cool features that maybe you're not aware of or don't use as often. So we'll get into that. So here is our homepage, 413cares.org. And really the main star of the show is this search widget where you can input the zip code and enter the Find Help platform to find, browse through their categories to see what you need. We have developed over the years based on the need. So LaVonna mentioned how food, housing, and mental and health are the top categories that folks are searching for on 413Cares. And so we have developed some resource pages from that and as well as partnerships in the past to do that. And so these resource pages are just small hubs of information that we have created where it can bring you some quick links to some resources, for example, food pantries and a meal site, food for older adults, for example, as well as some general information for SNAP, HIP, and all of that. So these quick links folks can click on and it'll give you a list of food pantries in Western Mass, for example. They don't include all of them, just the most common ones, and we try to update them periodically, but these are just quick links. And our other resource pages kind of mirror this structure. So if I go into housing, we have different categories for housing, whether you need shelter, need assistance navigating to find or apply for housing, maintenance and repairs, etc. So there's a bunch of information here. Disclaimer, housing is a big category. And so it can be difficult finding housing. So really reach out to your local housing organizations that help out with that. So definitely these resource pages can be of help for those that may find doing a search a little intimidating or may not know exactly what they need to find. So these resource buckets, these resource pages are really good places to find key information quickly. Now for a search, I'm going to do a Chicopee zip code to do a quick search. And so here we're entering the Find Help platform, where here at the top menu, you have a list of some categories. So we have food, housing, goods, transit, health, money, care, education, work, and legal. And within these categories, there are subcategories and even subcategories to the subcategories. And so if you can browse through all of these and see what you can find, but as well, there is a search up here where you can search for a keyword, a program name, or you can even change the zip code. So if I want to look at Holyoke or Springfield or in Great Barrington, Amherst, I can always change the zip code here and do my a search again. So for the sake of today, I will go into, let's look for preschool in Chicopee. I have square one in my head, so I'm thinking preschool in Chicopee. And so now that I am searching in Chicopee, in this preschool category, it pulls up a map of where these locations are in Chicopee that you can view. And from here, we can see that this search yielded 20 results. It's not that overwhelming. If I had more than 100 or 200, I may want to filter. So you do have some filter options, but if I'm looking for preschools, but looking at specific age groups for children, this can be really helpful. Or if I'm low income or I have a child with disabilities, I can, filter out based on my need or the need of someone I'm helping. So these filters are always an option to narrow down your search. As well as you can search by relevance or by closest distance. So just note that, especially when you have a lot of searches, a lot of programs that you yielded based on your search. So a quick look as I scroll down, we can just take a look at this first program card. So this is what we call a program card with just general information. It gives you some tags of what their main services are. So we have daytime care, after school care. So this really falls within what I search for in the population they're serving. And I can see they have a phone number and their address. More info is just that. So it gives you more information on eligibility. Maybe if I'm low income and I have a voucher, I want to see if they accept it or anything like that. More of a detailed description of the program. And as I scroll down, I could even see locations. So I believe they have various locations within Chicopee, and yeah, they have various locations within Chicopee. So I can see that. And then we have some other features that one can use. We really recommend folks to sign up for a free account with Find Help. It is free, and all it needs is your email and password. But with that, you can have access to some key features. So this save feature is one of our favorites. No pun intended. But if I wanted to create a list of preschools in Western Mass, or I'm working with someone that has various needs and childcare is one of them, I can create a folder based on, name it daycare centers in Chicopee or daycare centers in Western Mass, or I can name it after the client I'm working with. Sally Mae, have a whole folder catered to all the needs I need to address with her, and I can save them. And with that, I'll create a folder or a list of folders that I can share with her, print it out, email it out to her, etc. I can also share this program card with Sally Mae, this fake person I just created. And one of the great things about it is I can share email, text, or Facebook, but I can also, if Sally Mae maybe speaks Russian, for example, I can write a message to her and share this whole program to her in Russian or in any language, in Spanish, Swahili, German, etc. And now that I'm seeing this language call out, I do want to note that this whole platform can be translated into pretty much any language. So here at the top left corner, under the search bar, there is a select language drop-down menu, and I can click any language to have the page translated. This also exists back on our homepage. So if I go back to that, where before we did our search, you can also click this translate button, and it'll translate our whole homepage into a different language. So I just want to highlight that because I don't want to forget that. That is such an important feature to make this platform accessible to a lot of people. This notes feature is it's just that. It's a personal note you can create. So if I have contacted this program before and maybe I got a better phone number to use, another extension of a person that I can talk to, or any note you think is noteworthy to have, you can create a private note with yourself, or you can have a team if you're in an organization, you can have a team and share it with your team. And then lastly, this suggest feature it's just that if I see that maybe they actually changed their address, they're no longer 374 Montgomery Street in Chicopee, I can make that note and send it off, and that suggestion can be made so that they can change it so it can be as accurate as possible. Now, when I suggest something, it will go to the program. One thing to note here at the top right corner of a program card is this checkbox. It just means that someone at that organization works there, and so they manage this. And this is important so that all the information here is as accurate as possible. If a program doesn't have this check mark, it just means that it hasn't been claimed. So Find Help is really in charge of when they do their biannual checks of the site and of the programs, they'll review and make sure links are working, that the information is as accurate to the web page as possible. So here's the difference between a program that's claimed and then one that isn't. You just don't see that check mark there. And then most importantly, and really how, if I wanted to connect with this program, how would I do that, is this big teal button on the right. This button can say different things. So Valley Opportunity Console actually has a referral process in place. So I have this refer button. So let's say if I'm getting this for myself, I can put in this information and send my own referral to this program. But if I'm helping someone else, I can put in this information, make sure I have that person's consent that I'm referring them to this program, and send it off. And maybe for those that are on this webinar that do a lot of case management and want to track that on this platform, here where this button says apply on their site, if I were to, speaking to a client and I am telling them, to get in contact with this and apply on their site, I can log this referral for myself. This referral does not go to the program. It's just for myself, for my own referral tracking processes. So for those that are on this call that do client case management, that is a free feature for everyone. So like I said, the button looks different for everyone. It can be, well, for every program, it can be different. So it can be refer, apply, see next steps, and that just tells you how to connect with the program. And so that is really how to do a search and also how to connect. And so that is all on my end. If you have any questions, save them and share them using the Q&A feature or in the chat. And I'll be sure to answer them in the end. And so here, if you need help, I read in the chat someone would like us to have a training, so we will get back to you for that. But if any support you may need, whether it's for training, for getting your program, your service on this platform, requesting materials, etc., feel free to contact me or Lavana. And so I'll hand it back to Jessica.
Thank you so much, Francheska. That was really well done. And I do want to just congratulate you and Lavana and Sarita and the whole advisory board for how far this effort has come. It is really, truly impressive. So thank you again. I do now want to introduce Alan and Joe from the food bank, who are going to talk about their experience. We have 4 people who are going to be talking about their experience from their organization's perspective on 413Cares. So I will hand it over to them.
Hi, my name is Joanna. Like she said, I am with the Food Bank of Western Mass. We're located in Chicopee, and we work with many different partners across the region to help people access healthy food while also advocating for programs and policies that will eventually end hunger in our region. Next slide. I don't know who has the slides, but we offer, thank you. We offer a variety of programs to address food insecurity. We have the Food Finder that allows us to connect with people, pantries and meal sites close to their location. We also have the Brown Bag program that offers monthly food bag to bag of groceries for seniors, and our mobile program. We are where a truck brings fresh produce on a monthly basis to different locations across Western Mass. We also have the SNAP team that can help people with their application for SNAP benefits and help them to make sure that they're getting the maximum maximum in benefits. We have a nutrition team that holds many different nutrition events across the area. They also have they run a healthy food conversation course for those who are referred to us through 413Cares.
We can go to the next slide. Hi, I'm Alan Dallman, and I manage our food assistance navigation program. And Joe is one of three of our food assistance navigators who kind of do the work. And so, yeah, there's a lot that one can find out in the food world. And so we try to use 413Cares to kind of be an in-between spot so that those of you who are making referrals don't have to know all the details about all the possible food resources out there. And we work primarily with healthcare. So those of you familiar with social determinants of health questions, this slide kind of shows we try to capture people who screen positive for food insecurity. And that's by either answering sometimes or often to either of those two questions you see on the left. Those are the two food insecurity screening questions. So when healthcare, and all of you that have gone to whether it's a sick appointment or a well appointment, hopefully are asked a series of questions. Food would be a couple of them. You might fill it out before you go to the doctors. You might fill it out with somebody, or they hand you a clipboard. But the variety of ways, there's ways for them to find out, oh, this is somebody who could possibly benefit from some services. So we have several things on 413Cares, but we have one that gets a lot of traffic because it tries to capture everybody. And then our food assistance navigators can kind of connect them. And that's called food assistance navigation. If you go back actually one slide, what that does is it allows us to connect people to the programs Joe was talking about. So the local pantries, the SNAP team, the nutrition, you can see that in the upper corner. But beyond that, we realize that there's a lot of underlying causes of hunger, and many of those are related to money, right? If you don't have enough money. So if we can connect people to Valley Opportunity Council and Square One Wayfinders, where people can find ways of not spending as much money on childcare, fuel assistance, housing, et cetera, that might free them up to have some more resources for food as well. So we don't stop with food. We kind of continue, and 413Cares is a great way to then find that next referral for someone. Okay, next slide. And then, yeah, this is what you can look for. So if you put in your zip code and you're in Western Massachusetts and you actually type food assistance navigation, you can kind of get right to our stop. And then the teal button that Francheska was talking about, we have that refer button. So people can refer themselves, but most often it's someone else, community health workers, other social service agencies that will refer someone on our behalf. And all we really need is a name, a phone number, and that permission, that all important permission. I set my stopwatch, so I see we're close to our 5 minutes. So I'm going to make sure everyone has time and we have time for questions and answers. But we do track the data also. 413Cares allows you to put in a form like that can be customized to your organization. So we ask people when we contact them after they first contact them, we can contact them again in 3 months and re-ask some of those food insecurity questions. We can also see if they've successfully made it to some of the services that we've referred them for. And in a best case scenario, that service itself can tell us because it's they have access to changing the status of a referral that we give them. We can talk about that later on. And I will pass it back to Jessica, I think.
Yes, thank you so much for that beautiful example of usage. And next, I want to go to Jodi at Wayfinders.
Hi, thank you. Good afternoon. My name is Jodi Smith. I'm the Senior Vice President for Housing Education Services at Wayfinders. Housing Education Services is one of 3 departments in our Housing Center division. So Wayfinders is an affordable housing organization that works to bring housing stability across Western Mass. And so we do that in a variety of ways. We really across the spectrum of housing, from homelessness all the way to market home ownership. And so some of the ways that we do that, you know, I could talk for an hour on what we do because we have a lot of stuff going on. But I think this slide really kind of helps you see kind of all the things that we do related to housing. So we do have emergency shelter. So we have 279 units of emergency shelter that is a closed referral through the state. We also provide transitional housing for survivors of domestic violence as well as teen parents. We do rental assistance. So we administer federal and state vouchers, so Section 8 and mass rental vouchers as well. Emergency financial assistance, we provide emergency funds to prevent eviction and foreclosure through the RAFT program. Those funds can also help support utility shutoffs and if somebody is looking to move because they have a housing crisis. We also do education and counseling. So our home ownership and financial education program, we provide workshops for first-time home buyers. We provide workshops called Credit Success that really are focused on helping people learn about credit, learn about budgeting, learn about savings, and really make some goals from there, whether it's home ownership, whether it's buying a car. You know, what are those goals that somebody has? And we really try to work with them both in workshops and in counseling to be able to meet their goals. We engage with residents in our properties. We have 800 units right now, and another 400 in the pipeline. So wherever we have property, we also have a resident services program to really support the residents that are living with us. We provide community leadership and development in Springfield and Holyoke, really resident-driven things that they are looking to address, whether it's street safety, whether it's lighting, sidewalks, you know, walkability. And we also do a digital literacy component as well, and digital literacy training. We have a workforce development program, job training and employment supports. That's a regional program, really supporting people who are unemployed or underemployed. We have a fair housing program that is also regional. We provide outreach and education to tenants, as well as landlords and service providers on what housing discrimination is, kind of what isn't it, what is, you know, tenant rights and responsibilities versus discrimination. I indicated what we have for properties, but we also build. So we build housing as well. We also have a subsidiary common capital, which is a small business loan. So for people who are entrepreneurs and looking to start their own business. You can go to the next slide. And so the way that we use 413Cares, I'll talk about it in my department. I have three housing centers, one in Springfield, one in Holyoke, and Northampton, which is really a clearinghouse for all things housing. So people are walking in our doors every day. They are calling us, looking for resources and looking for support. And so I have staff that are answering a call center. We get about 35,000 calls a year. And so those staff that are answering the phone, those staff who are responding to walk-ins, they use 413Cares to find resources. People are coming to us for housing, but people don't just have barriers to housing when they're coming in. They have lots of other. Food is a great example. And so we're able to have those staff be able to go into 413Cares, pull out a relevant referral, and make sure that people have what they need. Referral mechanism, I think Francheska showed you. We also, and I think we'll show you at the end, we use that to allow people to refer in. And then we also use refer buttons within 413Cares to refer people out. We train staff when they first come in on 413Cares. We let them spend a lot of time navigating and getting comfortable with the system. That builds staff confidence. We want staff to feel confident when they're talking with people and working with people to be able to provide the right information. And then we market our own programs. So we update. We are responsible to make sure if things are changing, that we update those so people that are not at Wayfinders get the current and updated information. And I think that's it for me. So this is This is just an example. So our Housing Consumer Education Center, if you went on 413Cares right now, you would see that there is a refer button. So you can actually refer people in to us. It's an email that comes in. We see that information and then we can respond to that and make sure that the person is connected. And then our emergency financial housing assistance, there's an information there and for that program to find on the website.
Thank you, Jodi. Thanks so much for all the impressive work Wayfinders has done on this. Next up is Jasarah Burgos from New North Citizens Council.
Thank you so much. Hi, everyone. Thank you for being in this webinar. I'm very happy to be representing New North Citizens Council today. And like Jessica mentioned, my name is Jasarah Burgos. I am the Chief of Community Engagement. And our mission is to provide advocacy and public human services to preserve, support families, resulting in the improvement of their quality of life, with the emphasis on the multicultural community. Our organization serves Springfield, nearby communities in Hampden County, but we have some programs now that serve the entire state of Massachusetts. We have family services, substance abuse programs, gambling prevention. We have a small housing department, community development opportunities, youth services, reentry programming. We have a childcare center in the North End, and we also do a lot of early education programming. Next slide, please. So New North Citizens Council as an organization uses 413Cares to be accessible to the community. I think accessibility is one of the things that we really talk about when we're thinking through an equitable lens. And 413Cares allows us to be out there. So people that are searching in the platform are able to see our programs and know how to access any of the things that we're doing within New North Citizens Council. All of our direct services programs are listed in the platform. Individuals can learn how to access the resource, and community partners can make referrals, or individuals using the platform can do that as well. So we can do follow-up and track progress. Right now, we're trying to integrate this data component as a community organization, just to make sure that we are looking into the number of referrals that we're getting, number of referrals that our coordinators are doing outside of our organization. I think this is super helpful when it comes to reporting to any of our funders, or even when we're having internal meetings and planning for the next year. Looking at these numbers is really important to guide the conversations that we're having around gaps in the community when it comes to resources. An example is our Parent Child Plus program. This is our latest addition to the platform, and this is an early literacy program for families in Springfield with children from 18 to 30 months. If an individual conducts a search on the 413Cares platform, searching for early learning programs, within any of the Springfield zip codes, the program will come up in the search. So interested families or practitioners doing referrals will be able to have the option to refer their information to the program director. In this case, the information will get to me, and I will be able to get in touch with them and follow up to give them more information or even sign them up for that program. Next slide. And this is our contact information. On a more personal level, I will say that 413Cares, I use it not only as part of the organization of New North Citizens Council, but also just as a regular member of the community. I think when I moved from Puerto Rico to the United States, specifically here in the Springfield area, I was able to access a lot of the resources that really helped me get myself into a better quality of life, but also to be able to help my friends and families when it comes to searching for resources. 413Cares was a platform that really supported me in that process, in learning how to navigate systems around me. I think that one of the things that Francheska mentioned when she was doing the demo, having the platform in different languages really is an important component, because even though a lot of the people are bilingual, you feel more comfortable reading the information in your first language. So for me, as a Spanish-speaking person, I love to have a place where I can go look for resources that I can translate into my first language and feel more comfortable and more safe when I'm doing those searches. So thank you so much. That's it for me.
Thank you, Jasarah, and thanks so much for calling out the fact that this is actually public facing, and that community members like yourself in that example are able to access 413Cares. You don't have to go through an organization, so I really appreciate you highlighting that and glad that it was useful for you. So next we're going to go to Levana, and she is going to share. Michael Pratt wasn't able to be with us from Holyoke Safe Neighborhood Initiative, but Levana is going to give that update.
Thanks, Jessica. So yeah, there's always some last minute complications, and unfortunately, Mike Pratt couldn't be here on behalf of Holyoke Safe Neighborhood Initiative. I'm just so thankful for him and Ed Case's leadership on from Holyoke Safe Neighborhood Initiative and their involvement and support of 413Cares as well. And so I wanted to share a little bit about Holyoke Safe Neighborhood Initiative. They as Mike says, they really build up their community one person and one street at a time. And this is done through different types of engagement with the community. They have their basketball league, which engages 300 to 400 youth every year. They do other types of community building, different family nights and community cleanups and all sorts of stuff that really build connection with community and really try to provide connection to resources. So they're doing tremendous work in and around the Holyoke neighborhoods. And how they really use 413Cares is, first is connecting their residents to services that they can find on 413Cares. Through all their community engagement work that they do, they build so many impactful relationships. I know that Mike has shared that, there's also, as he coaches a certain basketball leagues, he's building relationships with young people that feel like they can go to him and say, I'm having an issue, or my family's struggling with this. And he can go to 413Cares to find and connect to resources like some of the organizations that have presented today and others in the community, and really help the young person that is coming to him to ask for help. So their staff are using 413Cares in that way. And they have us linked right on their website for anyone that to go on and do searches right from the Holyoke Safe Neighborhood Initiative website. And more recently, they just launched a basketball app for their basketball leagues. So, the nearly 400 youth and their families that are involved in the basketball leagues, there's an app now where they can get their calendar and stay up to date on other important information regarding the basketball programming. But they also integrated 413Cares right into the app. And so this view that you see right here is the mobile view, and there's a tab right to connect to 413Cares, so that young people or a parent that are using the app themselves for the program's purposes can also connect right to 413Cares right there. If there's something that they're in need of, they can go ahead and connect and search for what they need. So I just think that's really cool that they are integrating 413Cares in more of it in this technological way. And, I just want to say that we are happy to support things like that. We have on our website, anyone can go and pull our search widget that Francheska quickly showed in the beginning of her demonstration and integrate that right onto a website where, you could go to your organization's website and have that little search bar to search for what people are looking for, and people can connect right there that way. So, yeah, I'm sorry Mike couldn't be here, but hopefully you get a sense of what they're doing with the initiative.
Yes, thanks, Levana. That was great. Thank you. All right, so now we have some time to ask questions, and because there are none in the Q&A, panelists, I'm just going to throw some at you, and I guess you can just popcorn your answers. But in the brief time we have left, what happens if you can't find something on 413 Cares? If I was looking up for employment or something like that, what's the trick to tell people?
I will share just, you know, what's one of the other things about 413 Cares is it's, you can do a little bit of crowdsourcing. And so anyone, if there is something that you're looking for that you know you're expecting to be able to find, if you're not finding it, anyone can go ahead and suggest a new program to the website. So that's a helpful feature because while there are a tremendous amount of programs on the platform, there's new programs and services that are popping up, and anyone can go ahead and get those listed. Find Help will verify that program information before publishing it, so that there's some cross-checking and verifying of information and validity of that. But that's a really good tool for anyone to be able to do, and you can suggest right from our homepage. There is a link to suggest a new program. But I'll leave it to other panelists if there's anything else you want to share.
Yeah, and honestly, you know, it's 413 Cares isn't magic, right? So it's not, if nobody's distributing diapers in a certain zip code, then you're not going to see an organization that does that. So it's not it's a great answer for many things, but it doesn't fill, doesn't fill voids that are there before there was 413 Cares. So it's it's not magic in that sense. And so, yeah, that can be a challenge. I know Joe just jumped off. She might be talking to someone right now. And sometimes you do have to just have that difficult conversation. Well, we're not finding anything, and you can pause and say, well, I'll take another look and can come back to you. So we do like to have follow-up conversations. We do and that's what's nice about 413 Cares is that we have a list. We know when they came in, and we can kind of, oh, it's been 3 months. Let's check to see how this person's doing.
And I can add a little bit more to that. Like looking at the bigger picture, if you can find something in 413 Cares, that brings us as community organizations to have a conversation around gaps, right? Maybe this is a resource that is not in that community, like Alan mentioned. How can we then move our organizations to work towards adding that resource in that area that is not available, right?
That's great. Thank you. I know we just have time for one more question, I think, because we do want people to take the survey before they drop off. But how do you get staff to do this? Like, how do you build that muscle within your organizations to have staff use this tool?
I can talk about that. I think it's buy-in, right? That, they don't have to sift through paper and outdated manuals. We introduce it. It's, we've added it into our training checklist. So it's part of orientation and onboarding. And so staff really see the value in it because they don't want to be stuck without a place if somebody needs something that Wayfinders can't provide. Wayfinders is not the end all be all, right, of the barriers that people are facing. So those staff, they want this kind of resource. And so they totally bought into it. They don't have to spend hours in a manual or updating manual. So it's been really huge for us.
That's great. Was there a big push in the beginning though, Jodi? Like, did it take a little while?
Yeah, I think we were trying to kind of figure it out. And I think, just over time, just really understanding the value. And I think we're still trying, creating teams and then people messaging and making recommendations. I think there's so much that you can do in the system. And I think we're still growing in that area. But staff, have definitely have bought. So.
Excuse me. Sorry. Thank you. Alan, were you going to say something?
Oh, just quickly say there's two layers of it. Like, does everyone on your staff know about it? And that's simple so whenever they have contact with the public, have you heard about 413 Cares? So that's one level that everybody can get, and you can do one demonstration for everybody to see how it works. But then our strategy is to have, like my staff 3 that really knows it. And so we try to get things directed to them that can spend the time on it.
That's great. Jasarah, were you going to say something?
I think that having the accessibility of then looking back into the referrals that you have made and using that data to push the work that you're doing and like reassessing and changing things in your scope of work. I think that's the buy-in for my employees right now. They're like, they're super happy to being able to just like look back of a quarter and see like what was the people in the people that we're serving in our office really looking for, and how can we push more work that supports them in addressing any needs that we're seeing. So
okay, thanks. There is one important question that just came in the Q&A, which I would like to just say, which is about for folks that don't always have digital access, computer access. Your staff are able to help people that don't have access in that way. Would that be your, or do you have an answer to that question?
I wanna add to that. So one of the cool things about the platform is that if somebody comes into the office and they're looking for a resource, we can do the search for them and then print the information in a paper form that they can take back and then follow up or do the referral, so that then the organization that we're referring to can get in touch with them via phone call or text message. So they don't have to have access to internet or a phone or smartphone. Once they walk into our office, we're able to do that referral, print information for them, or make a referral so somebody from the other organization can get in touch.
Oh, that's wonderful. Thank you so much for that comprehensive answer to that very important question. So I know we are close to time. We do really hope people will take the survey. It's about 1 to 2 minutes. So before you log off, Kelly Waldner, who's been behind the scenes, I want to thank her very much for this webinar, and all of you for your continued commitment and dedication to 413 Cares. We have videos and stories of how having the resources has really changed people's lives. And so thank you for being the conduits at your organizations for making this available. And also the question about how do we outreach and market 413 Cares. I think it takes all of us, but we do have the website and we do have videos, and we've tried to do commercials and different types of marketing tools over the years, but really, I think the word of mouth is oftentimes the best. So thank you everyone for participating. Thank you, Lavana, Francheska, for your great work. And I hope everyone has a wonderful Friday afternoon and weekend.